Hi everyone, it's Dr. Barry. I am the one in the office this week. My partner, Dr. Ashby, did a couple videos for us last week and he was awesome here seeing urgent patients in our office. As you guys have probably seen from us, we are rotating. This is my week here to see urgent patients in the office, and we're doing everything we can to keep our patients and our staff safe, but still be here for you. So you'll see some posts, and I know you probably have already seen some posts about our virtual visits. They've been going really well. It gives us a chance to at least say hi to you and say, see what's up and if we can help. And it does allow us to use a video visit through our Clara messaging platform. The nice thing about that is it's a HIPAA safe platform, and we get to still see your face, and you can hear us and we can see you and still give you at least a little bit of advice in this kind of unprecedented time. So I'm going to be talking today on one of the common things that we see in ENT, and that's tonsils and adenoids, actually. Dr. Ashby, if you haven't checked them out already, has done an awesome job video-wise for us on one of the surgeries we often do here in the office, balloon sinuplasty, and what that entails, and some things about the sinuses. So we're going to switch from the nose portion. You can see on my wall I have a couple paintings here in my office. We're going to go not from the ear but the nose, but we're going to start talking about a little bit of the stuff in the throat here, the tonsils and the adenoids. So everybody kind of knows the tonsils, but when they talk about the tonsils, we are all thinking about the palatine tonsils. We actually have quite a few more than those. The tonsils that we think about, the palatine tonsils, are the ones that live straight back in the back of your throat there. But there's another pad of a tonsil tissue called the adenoid pad that lives behind the nose. And that can be something that causes some nasal obstruction and also, unfortunately, traps a lot of yicky things, some postnasal drainage, some allergy drainage. I can also trap some other things, which we'll talk about. There are actually tonsils that live in front of the eustachian tubes called the torus tubarius tonsils, and tonsils that live behind the tongue, the lingual tonsils. So those actually create what we as ENT know as Waldeier's ring. And before age 2, that serves a really good immune function for us. After age 2, those things can start working like dirty sponges. So one of the things that we see patients for tonsil-wise is infections. And for those of you that have had strep throat, that is a miserable thing. We understand that. That is definitely not a fun thing to have, especially if you have it recurrently. And the tonsils can become a carrier of strep throat in that fashion. Or you may just be someone that's kind of susceptible to that. So certainly we see tonsils for tonsil infections. These days, that's actually the less common reason we do anything with the tonsils. So oftentimes when you've made it to us, we kind of are talking about, or kind of maybe to the point where we may need to talk about surgical removal of the tonsils, but there are other options, and we certainly are happy to see you for strep throats, get you swabbed and get you treated appropriately if that's something that you battle with. In terms of the more common reason we actually see tonsils nowadays is actually for obstruction. So when we talk about obstructive sleep apnea, or another newer term, something called sleep disordered breathing, which is just a fancy medical way of saying something's not going right when you're breathing at nighttime. For kids, this can be evident as snoring is kind of the first thing that perks our ears up, because kids, we shouldn't anticipate really having a significant amount of snoring. And so when we hear that, we kind of wonder if there's something going on that's obstructing the airflow there, and tonsils and adenoids can be a big one. So that can get swollen and stay swollen for a lot of reasons, but the concerns for us in ENT is when you have enlarged tonsils and adenoids and that is obstructing your breathing, is how that oxygen flow is going on at nighttime. Particularly for kids, this can lead to really restless sleep, wiggle worm sleepers, as I like to call them, people that wake up oftentimes multiple times at night. Some kids that kind of keep their mouth parted open, I lovingly call that our Darth Vader breathing. If they can't close their mouth and breathe through their nose, or you hear that kind of very pretty pronounced sound when they try and breathe in through their nose, that can be a sign of enlarged adenoid tissue. So even dental things, we're kind of noticing a correlation between that and tonsil enlargement and adenoid enlargement. And thankfully, we're very grateful for our dental and orthodontic colleagues that are seeing that in kids, and we're catching it earlier when that's present, because it can actually shift the teeth and lead to gaps in the teeth, or what we call a V-shaped palate, so a change in the tooth pattern. That can make orthodontics a little bit harder of a job, and some other things breathing-wise. But That is also something that can lead to teeth grinding at night. So lots of things that the tonsils can do. And the adenoid pad there. Another thing we see that bothers people with tonsils are pesky tonsil stones. A lot of people, if you have them, you know what they are. If you haven't ever had them, you may not know what they are, but they're a little kind of almost like white bits. They do look like little mini pebbles or stones. And that is something that actually happens because the tonsils, a little food debris gets trapped in the tonsil, and the bacteria that live in our mouth kind of go and calcify that or make it a hard little stone. They're yucky things. You usually spit them up, or they even sometimes irritate the back of the throat and can kind of give you the sensation of like a popcorn kernel lodged back there until you can get them out, or cough them up or spit them up. And some people will kind of even have to scrape back there with Q-tips to get them out before that they've seen us here. Tonsil stones can lead to bad breath, and they can lead to a lot of chronic sore throats. So we definitely see patients with tonsil stones. Sometimes it's so severe that we do take tonsils out for that. So there are, it looks like we just got a comment here about my 15-month-old snores, but doesn't have enlarged tonsils or adenoids. So definitely something we would want to look at and see. Sometimes snoring can be a sign of stertor, which could be nasal obstruction that can cause that. So even though the adenoids may not be a problem, there may be something else going on. So Courtney, definitely something we'd be happy to take a look at for you. And see what's going on in that regard. In terms of the tonsil stones, as I was just talking about, there are some medical treatments and some other things that we might try for you, but we definitely know patients can sometimes get to this point where they have terrible breath and just constantly feel like they're digging back there too, and that's something we're definitely happy to see you for as well. I do have, this is actually a little handout I was looking at before this video that we do give patients when we're kind of looking at, but so that you can kind of know what I'm talking about when we talk about the adenoids. Let's see if you can see that here. The palatine tonsils are the one we kind of always think about or talk about, but the adenoids, as you can kind of see right there, I don't know if that's blurry or clear, but that's right at the back of the nose, so you can see that gives trouble. One of the other thing I might mention to you there, Courtney, I still see that thing popping up in our feed here about the enlarged tonsils or adenoids. Adenoids can regrow, so it is possible if it's never been looked at that sometimes those adenoids unfortunately can come back and cause some trouble, but it might be something else there. And so that is definitely something we would be more than happy to see and give you some peace of mind for. I'm going to be in the office this week. I'm miss seeing our patients here, but we're doing everything, as I said, that we can to still be able to talk with you guys and see you by these telemedicine visits. Certainly we're seeing urgent patients here, but we're doing what we can to kind of flatten the curve, as we've all learned to say or do here. If you have any topics that you guys have questions about, or you have any questions for me today, please just go ahead and send us a message or tag me and send us a message or call us here at the office. I'm happy to take a call. Our office number is 269-343-1296. Thanks for watching, and I'll talk to you guys later this week.